Rabeprazole, also known as Aciphex Sprinkle, is a medication used to treat stomach and esophagus problems such as acid reflux and ulcers. It works by reducing the amount of acid produced in the stomach, which can help relieve symptoms like heartburn, difficulty swallowing, and cough. This medication also helps to heal acid damage in the stomach and esophagus, prevent ulcers, and may reduce the risk of esophageal cancer. It belongs to a class of drugs called proton pump inhibitors, PPIs. The recommended dosage of Aciphex Sprinkle is typically once daily, and it is best to take it at the same time each day for the best results. It can be taken with or without food. If you miss a dose, take it as soon as you remember. However, if it is almost time for the next dose, skip the missed dose and continue with your regular dosing schedule. It is important to take this medication exactly as prescribed by your healthcare provider. Before you start taking Aciphex Sprinkle, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. If you're taking the tablets, follow your doctor's instructions and take the dose by mouth with or without food, usually 1 to 2 times daily. Swallow the tablet whole with water, and do not crush, chew, or split it to avoid any potential side effects. For those using the capsules, take the dose 30 minutes before a meal, as directed by your doctor. This is usually done once daily. Don't swallow the capsule whole, instead, open it and sprinkle the contents onto a small amount of soft food or liquid. Make sure the temperature of the food or liquid is at or below room temperature, and swallow the entire mixture within 15 minutes of preparing it. Don't chew or crush the prepared mixture. The dosage and length of treatment will be determined by your medical condition and your body's response to the medication. In children, the dosage is based on weight. You may take antacids along with this medication if needed. However, if you're also taking sucralfate, make sure to take rabeprazole at least 30 minutes before sucralfate. For the best results, use this medication regularly and at the same times each day. It's important to continue taking this medication for the prescribed length of treatment, even if you start feeling better. If your condition persists or worsens, be sure to inform your doctor. The risk of side effects may increase over time, so it's important to consult your doctor about the duration of your medication. If you experience a headache that lasts or worsens, let your doctor or pharmacist know right away. Remember, this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, it's important to tell your doctor immediately if you experience symptoms of low magnesium levels, signs of lupus, severe diarrhea, or abdominal pain/cramping with blood or mucus in your stool. Also, do not use anti-diarrhea or opioid products if you have these symptoms, as they may make it worse. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile, so it's important to contact your doctor if you develop persistent diarrhea or stomach pain. Additionally, long-term use of this medication may rarely cause a vitamin B12 deficiency, so be sure to inform your doctor if you experience symptoms such as unusual weakness, sore tongue, or numbness/tingling of the hands/feet. Lastly, a very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before taking Aciphex Sprinkle, make sure to inform your doctor or pharmacist if you have any allergies to rabeprazole or similar drugs, or if you have any other allergies. It's important to be aware that this medication may contain inactive ingredients that could cause allergic reactions or other issues. Before using this medication, discuss your medical history with your doctor or pharmacist, especially if you have liver disease or lupus. If you experience heartburn along with lightheadedness, sweating, dizziness, or chest/jaw/arm/shoulder pain, seek medical help immediately. Also, if you have unexplained weight loss, it's important to talk to your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are currently using. It's important to note that taking proton pump inhibitors, such as rabeprazole, may increase the risk for bone fractures, especially with longer use, higher doses, and in older adults. It's recommended to discuss with your doctor or pharmacist about ways to prevent bone loss and fractures, such as taking calcium and vitamin D supplements. Older adults may be more sensitive to the side effects of this drug, especially bone loss and fractures, as well as C. difficile infection. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's uncertain whether this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Aciphex Sprinkle. Some medications may not work as well when taken with Aciphex Sprinkle, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. One specific drug that may interact with Aciphex Sprinkle is methotrexate, especially when taken in high doses. Additionally, some products need stomach acid to be absorbed properly, and since Aciphex Sprinkle decreases stomach acid, it may change how well these products work. These affected products include antibiotics like ampicillin, antiviral medications like atazanavir, and certain antifungal medications. It's essential to discuss any potential interactions with your doctor or pharmacist before starting Aciphex Sprinkle. Lastly, it's important to note that Aciphex Sprinkle may interfere with certain lab tests, potentially causing false results. Be sure to inform your lab personnel and doctors that you are taking Aciphex Sprinkle to avoid any potential issues with test results. If you suspect an overdose and notice severe symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Aciphex Sprinkle with others. If your doctor has prescribed Aciphex Sprinkle for you to take regularly over a long period of time, they may also want to monitor your magnesium levels and vitamin B12 levels through lab tests. It's important to keep all of your medical and lab appointments and to consult your doctor for more details about these tests. If a dose is missed, take it as soon as you remember. If it is close to the time of the next dose, then skip the missed dose and take the next one at the regular time. Do not take a double dose to make up for the missed one. It's important to store Aciphex Sprinkle at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult your pharmacist or local waste disposal company for proper disposal methods when the product is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.